Hello class, my name is Janet Velez Nieves and I'm here doing my presentation on acceptance commitment theory as one of my contemporary theories. Today I will guide you through an exploration of ACT. As a mental health therapist, it is crucial for us to stay abreast of diverse therapeutic models that can enrich our understanding and embrace our ability to support individuals in the journey towards psychological well-being. ACT was developed in the late 20th century and has emerged as a powerful and empirically supported therapeutic framework that goes beyond approaches. It offers a fresh perspective on the human experience, emphasizing acceptance, mindfulness, and committed actions as a key pathways to fostering psychological flexibility. In this presentation, we're going to be delving into the central construct of ACT, understanding what causes dysfunction from its viewpoint, explore the nature of the therapy within this model, and examine its practical applications. Additionally, we will critically evaluate the empirical support for ACT, identify areas that warrant further research, and consider its intersection with faith and multiculturalism. I encourage you to actively engage in the exploration of ACT, think about some questions, and consider how its principles can resonate with your own therapeutic philosophy or practice. So, ACT is a therapeutic approach that falls under CBT. Developed in the late 20th century by Hayes, Wilson, and Strassel. ACT is known for emphasis on psychological flexibility, the ability to be open, adaptable, and effectively engage in the present moment, even in the presence of difficult thoughts and feelings. ACT's central construct involves fostering psychological flexibility through cognitive diffusing, acceptance, present moment awareness, self as a context, values clarification, and committed actions. Designed to help individuals to develop a mindful and accepting relationship with their thoughts and feelings while taking purposely actions aligned with their values. According to the ACT, dysfunction is perceived to arise from psychological inflexibility, characterized by an individual's inability to adapt and respond to effectively to life challenges. Psychological inflexibility involves being entangled with one's thoughts and feelings, leading to avoidance, struggle, and narrow focus and rigid patterns. This lack of flexibility, specifically the avoidance of internal experiences and struggle against unwanted thoughts and emotions, is seen as a primary contributor to dysfunction in ACT. When individuals are unable to accept their internal experiences and are unwilling to change their behavior to pursue goals, it can result in psychological distress and impaired functioning. So, to say the dysfunction in ACT is rooted in the concept of psychological inflexibility, where individuals struggle against or avoid their internal experiences, hindering their ability to live a meaningful and fulfilling life. So the Nature Act. So in the Nature Act revolves around psychological flexibility again. It is the ability to adapt to the present moment, accept internal experiences, and commit to actions aligned with one's values. It is a collaborative and experiential process that empowers individuals to live a more meaningful life. It includes mindfulness that incorporates Thus, mindfulness benefits encouraging an individual to create present moment awareness. This involves being fully engaged in the current experience without judgment. Mindfulness practices, such as meditation and awareness exercises, are often integrated into ACT to enhance clients' ability to observe their thoughts, feelings without getting entangled in them. Acceptance is also another one of the practices. ACT places strong emphasis on accepting one's thoughts and emotions rather than attempting to control or eliminate them. Clients are encouraged to adopt an accepting stance towards their internal experiences, recognizing that struggling against these experiences may contribute to a psychological distress. Value-driven action. The therapy encourages individuals to identify their core values, what matters most to them in life. Clients then work towards aligning their actions with these values, even in the presence of challenging thoughts and emotions. This process is known as committed action. Then we go into cognitive diffusion. This involves helping the client detach from their thoughts and see them as what they are, just thoughts. Cognitive diffusion techniques aim to reduce the impact of unhelpful thoughts on behaviors and emotions. And last but not least, experiential exercises. ACT often includes experiential exercises that bring these principles to life. Clients engage in activities that highlight the importance of being present, accepting thoughts and feelings, and taking committed action. We're going to see an example of this in a video in later slides. So for the role of the assessment, it is comprehensive and focuses on understanding the individual experiences, values, and psychological flexibility. It includes careful diagnostic interview. ACT encourages a thorough diagnostic interview to gather information about the client's presenting concerns and current psychological functioning and history. This interview helps in understanding the context and tailoring the therapeutic approach to the individual's needs. Self-reporting is another one of those assessments. ACT doesn't really rely on traditional diagnostic tools, but it may incorporate self-reporting measures to assess psychological inflexibility, values, and other relevant factors. These measures provide valuable insight into the client's subjective experience. There are other forms of assessments beyond the traditional assessment tools. ACT involve ongoing experiential assessments during sessions. The therapists observe how clients respond to different exercises, gaining real-time insight into their cognitive and emotional processes. For the counselor, in ACT, a counselor takes a non-directive, supportive, and educational role. While not providing direct advice, the counselor actively engages clients in mindfulness, exercises, values clarification, and other therapeutic processes. As for non-directive and supportive, the counselor in ACT takes a non-directive and supportive role instead of prescribing solutions or providing direct advice. The counselor facilitates the exploration of the experiences, thoughts, and emotions. As for the educational portion, the counselor also plays an educational role, helping clients understand the principles of psychological flexibility, mindfulness, and acceptance. This psychoeducation is crucial for empowering clients to apply these principles in their life. In active, while non-directive, the counselor is actively engaged in guiding clients through mindfulness exercises, values clarification, and other therapeutic processes. The goal is to foster self-discovery and promote psychological flexibility. As for the clients do take clients are active participants in the therapy, engaging fully in therapeutic exercises, mindfulness practices, and discussions. Active self-reflection is a fundamental aspect of self-awareness and commitment to value. Clients are active participants in the therapy process. They are encouraged to engage fully in the therapeutic processes, mindfulness practices, and discussions. Self-reflection. The client's roles involves self-reflection, exploring their thoughts and feelings without judgment. This self-awareness is a fundamental aspect of psychological flexibility. And last but not least, the commitment to values. Clients play an active role in identifying and committing to their values. This involves exploring what truly matters to them and aligning their actions with these values. As for goals of therapy in ACT, the overarching goal of ACT is to enhance psychological flexibility. That's the key. Empowering clients to accept internal experiences, be present in the moment, and take action aligned with their values. The therapy aims to provide overall well-being and help clients live a more meaningful life. Psychological flexibility. The overarching In this, I'm going to play a short 2-minute video that it gives you an example of one of the ACTS techniques by Dr. Hayes. So that is an example of cognitive diffusion. You also have mindfulness, values clarification exercises that help clients identify and align with their core values, and committed action involves taking purposeful, values-based actions despite challenges. So in the research, some of the strength, ACT has garnered empirical support for its effectiveness in various clinical contexts. Research indicates positive outcome in treating conditions such as anxiety, depression, and chronic pain, amongst others. Some of the limitations, while there is evidence supporting ACT, some critics suggest that the empirical base may not be as extensive as for more traditional therapeutic approaches research with diverse population. A long term, as for further areas of research, so we need to study further individual differences. Further exploration on how individual differences influence the effectiveness of ACT is needed. Research could investigate factors such as personality traits, cultural backgrounds, and specific clinical populations, and also long-term effects. Additional research should examine um, long-term effects of ACT intervention to assess the sustainability of the positive outcome over extended periods of time. So how does this work with multiculturalism and faith, right? So as a strength, ACT is inherently flexible and adaptable, allowing for integration with various cultural backgrounds. Its emphasis on values can resonate well with individuals from diverse uh, cultural backgrounds. In some considerations, while the core principles of ACT are applicable across cultures, there is a need for ongoing research to better understand how cultural nuances may influence the implementation and effectiveness of some specific techniques. So, how does ACT, we have to talk about how does it work with the Christian worldwide. So, the alignment, ACT emphasizes on acceptance, mindfulness, and values-driven actions can align with certain specific aspect of the Christian worldview. The accepting component may resonate with Christian teachings about embracing oneself and others. Potential tensions may arise concerning the mindfulness aspect as Christian perspectives on meditation can vary. Additional further theological reflection is needed to explore compatibility act with specific Christian doctrines. So here you have the link. So if you would like to hit it, to click on the link, it will take you to some of the resources I found, some books that will be really helpful if you're interested to look more into ACT, no affiliations. Some of the academic texts, these are mostly by Hayes, and also some online courses and workshops that I found that are available if you're interested to learn more about ACT. And these are my references. Any questions?